Hello and welcome to vlog number 126. This week, at the request of blog follower Peasant Farmer, I'm going to talk about the diagnosis of conditions which appear to be related to Parkinson's disease. There are a number of neurological disorders which have similar symptoms to Parkinson's disease. The term Parkinsonism is used to indicate that a patient has the four typical motor symptoms of tremor, bradykinesia, slowness of movement, postural instability, poor balance, and muscular rigidity. The most common cause of Parkinsonism is Parkinson's disease, but it is reported that around 15% of Parkinsonism is due to conditions other than PD. It can be very difficult to make an accurate diagnosis in the early stages of PD because it may be that symptoms unique to another Parkinson's-related condition have not yet revealed themselves. So, what are these other conditions and what differentiates them from Parkinson's? My misdiagnosis in the mid-90s is a case in point. I was referred to a neurologist for tremor in my left hand and right leg. In the absence of any other of the classic PD symptoms, I was diagnosed with benign essential tremor. It was only when my tremor had progressed significantly, some 16 years later, that I received a diagnosis of Parkinson's disease, because by this time a number of other PD symptoms had begun to make themselves known. Parkinson's plus syndromes are a group of conditions that have the symptoms of Parkinson's, so Parkinsonism, as well as other symptoms. These syndromes include multiple system atrophy, MSA, also known as Scheidegger syndrome, progressive supranuclear palsy, PSP, dementia with Lewy bodies, DLB, and corticobasal syndrome, CBS. MSA is a collection of several rare neurological conditions that progressively affect the central and autonomic nervous systems. The average age of onset is the mid-50s, and symptoms may include a lack of coordination, slurred speech, swallowing difficulties, dysfunction of the autonomic nervous system which can affect things such as blood pressure, bowel and bladder function, heart rate, increased sweating, sleep apnea and sexual function. Initially, PD medications may alleviate the symptoms of MSA, but MSA tends to progress much more rapidly than PD. PSP is a rare condition which may initially look like PD, but affects the parts of the brain involved in walking and balance, eye movements, speech and swallowing. A defining symptom is the inability to control the movement of the eyes, particularly looking up or down. Additionally, many people with PSP experience changes in mood and behaviour, such as depression, apathy and progressive dementia. People with PSP tend to stand up straight and fall backwards, whereas people with Parkinson's tend to stoop forwards. Parkinson's medications are often tried for PSP, but rarely provide any relief. DLB, or dementia with Lewy bodies, is a progressive neurological condition in which abnormal deposits of a protein called alpha-synuclein, Lewy bodies, build up in multiple areas of the brain, causing memory and thinking problems and hallucinations. Parkinsonism follows as the condition progresses, with the patient developing tremor, rigidity, bradykinesia and a shuffling walk. PD medications may be useful to alleviate the symptoms of Parkinsonism, but they can also make hallucinations worse. CBS shares some symptoms with PD, such as tremor, rigidity, bradykinesia and postural instability. Corticobasal syndrome is named after the areas of the brain which it affects. It results in the loss of nerve cells in the surface of the brain, the cerebral cortical areas, and deeper structures, the basal ganglia. These areas are heavily involved in movement, so CBS causes mobility problems. In contrast to other types of atypical Parkinsonism, CBS is asymmetrical, symptoms starting on one side of the body and remaining worse on that side throughout the course of the disease. CBS is characterised by the gradual loss of use of one hand or leg, and patients may also experience dystonia, muscular pain, muscular jerking, and eventually irreversible muscular contractions, all involving the same side of the body. There can also be cognitive problems, language problems, personality changes, compulsive behaviour and inappropriate behaviour issues. Treatment with PD medications may improve mobility and lessen muscular rigidity, although results are often disappointing. Thanks for watching. If you have any questions or have a topic that you'd like me to cover in future vlogs, just leave me a message in the comments and I'll do my best to respond. Have a great week. See you next Friday.